Hello, my name is Kushal. I work as an occupational therapist in London. Today I'm going to talk about postural tachycardia syndrome, which is the short form is POTS. Now, I'm going to show you some exercises that you can do if you have been diagnosed with POTS. It's a very new condition and people are gaining more understanding of about the condition. Still, we don't know quite 100% what causes POTS, but what we know that people who have been diagnosed with POTS, also up to 32% can be diagnosed with EDS, which is the Ehlers-Danlos syndrome, which is the hypermobility syndrome. So those two conditions goes hand in hand together. So hopefully in coming days we will learn more about what is the cause, and then we might be able to do better treatment. But based on the information that we have, there has been some couple of exercises programs that is recommended. Obviously, POTS involves feeling of dizziness, in changing of posture. So I'm going to show you 2 or 3 exercises that you can try. But when you are doing these exercises, if you have been diagnosed with EDS as well, just be careful, because depending on how hypermobile you are, because I went to see a patient who could not move at all from the bed, because every time she moved, she dislocated a joint. So that is quite an extreme case, quite a rare case, quite extreme case. But if you have been diagnosed with EDS, depending on severity, I would recommend seeking professional guidance before doing any of these exercises. So with POTS, the heart rate increases. I think the evidence suggests that it's a combination of exercises and medication is the best way to control the heart rate. Sometimes people's conditions improve, but those are the basic factors. So this video is generally to raise awareness about general population about POTS and to give you some ideas. So what I would suggest is that when you start the exercises, it's better to be done in lying, because you are more in a stable base and there is not fluctuation of your head position. So the feeling of sickness, dizziness will not kick in. So let's start with it. I'm going to lie down. And the first exercise I'm going to show you is just ankle pumping. And that can improve your circulation and it can improve your condition. So obviously, because of lack of space, I'm semi-lying, but find a position where you can lie fully. Yeah, that's once you have done that, the next best exercise is bridging. So bend your knees, keep them slightly apart. Now lift them up, but before you lift them up, tighten up your glutes, the bum muscles, and lift them up and hold them for a count of 20 or so. Now the other exercise you can do that is also quite effective in helping people with POTS is pelvic tilt. So basically you bend the pelvis upwards, then bend the pelvis down, push it down, and curve the spine. So this is the movement you can do in lying. And finally, the last exercise I would suggest is that you can lie on your side and practice getting up. And that might be quite a good way of getting up from the bed, because if you are lying down on the bed and if you're getting up straight like that, you might get dizziness. Whereas if you first lie on the side, go on your side, and then push up from the side, it will help you to control the dizziness. I hope this makes sense. If you have any questions or anything, please let me know. I will try to answer my best. Thank you.